So in this class we will see about the radial nerve palsy. Okay. So any idea about radial nerve palsy? Do you have any idea? Master, tell me your overview about radial nerve palsy. Okay. So due to any form of neurological disease or any road traffic accident or any type of injury which affects the radial nerve leads to paralysis of the muscle which is supplied by the radial nerve. Okay. So what are all the muscles will be supplied by the radial nerve? Extension. So major muscles. So extensor group. So approximately soluna forearm extensor group muscles. So forearm extensor group muscles are supplied by the radial nerve. So forearm extensor group muscle will origin from which place or which spot? Common origin point of the extensor muscle. Medial epicondyle or lateral epicondyle? Medial. So lateral epicondyle. So where is the lateral epicondyle? Thumb side or little finger side? Thumb side. So from in this lateral epicondyle, the extensor muscle will origin and supplies over the fingers. Okay. So any injury occurring in this area will lead to the deformity called wrist drop. Okay. Will leads to the deformity called wrist drop. So wrist drop means patient can't able to do wrist extensions. Okay. Patient can't able to do the wrist extension movement. Okay. So for that we can in physiotherapy we can give the treatment called stimulation. So in that stimulation by means of SD curve we can choose the type of curve. Okay. So by means of SD curve means whether the particular muscles are being innervated by radial nerve or denervated by the radial nerve. So innervated or denervated means nerve supply is there but action is not there. If denervated means action also not there, nerve supply also not there. So if the muscle is considered as the denervated muscle, then we will choose the stimulation for galvanic type of stimulation. If whether the muscle is innervated means we can choose the stimulation of paralytic stimulation. Okay. So now we will see about the paralytic stimulation. So for this wrist drop condition, we can use the paralytic stimulation. In that paralytic stimulation, what are the electrodes are present? So active electrode and then the inactive electrode. So inactive electrode we can fix the above to the muscle origin point. So somewhat around lateral side of the lower arm region, or otherwise we can place over the nape of the neck. So nape of the neck will be exact point. If patient is discomfort with in this point, or patient is somewhat irritable in this point means we can place inactive electrode over the lateral side of the lower arm region. Then active electrode over the motor points of the forearm extensor muscles or muscles which is supplied by the radial nerve. Okay. So for that patient position, we make the patient in the sitting position with pillow support. So pillow support should be over the 90 degree placement. So shoulder should be 90 degree, forearm should be in 90 degree, and wrist and finger should be in the 90 degree. So 90 degree, and then 90 degree. So that we can able to initiate the extensor muscle. Okay. Otherwise, because of the gravitational force, it will be difficult to initiate the action of the particular muscle. Okay. Is it clear still now? If you have any idea, if you have any doubt, means you can stop and ask the doubt. Okay. So name any one muscle which is supplied by the radial nerve. Extensor carpi, radialis. So it's supplied to which finger? So somewhat around lateral side of the three fingers, extensor carpi, radialis. Okay. So for that, where will be the motor point will come? Where will be the motor point will come? Proximal part or distal part? Proximal part. So patient having full of hairy skin. So it will be considered as the indicated or contraindicated? Contraindicated. Okay. So for teaching purpose, for just we will give only for 1 or 2 minutes. So it will not result in any burns. Okay. So we are placing over this area. After placing the pin electrode, we can able to start the intensity and ask the patient if he feels any discomfort ask him to inform. Okay. If you feel any discomfort means you can inform me, sir. Are you able to feel the stimulation or contraction? Are you able to see the contraction over this area? So it will initiate the extensor. If the contraction is not seen means we can increase the height of the wrist in the extended position by placing the folded towel over in this region. Assume that this is the folded towel. Okay, I am placing below the wrist and fingers. So now we can able to see the muscle activity. Are you able to see the contraction? So how many contraction we have to give? 60 seconds. If galvanic stimulation means 30 to 35 contraction, visible contraction. Okay. What are all the indication and contraindication of this stimulation? What are all the indication and contraindication of this muscle? Same indication and contraindication means like any other modality. So hairy skin, patient with the cognitive deficit, patient with any metal implant, and then any open wounds, any psychological involvement. These all comes into the contraindication. So like this patient, we can't able to give any form of electrical treatment. So what will be the indication? Paralysis, then fist drop, then injuries. Okay. So tell me about clinical anatomy of the radial nerve. Okay. Okay. So major one is it will comes from the radial plexus posterior cord and it will give nerve supply to the triceps and also anconeus, and then after crossing the arm region it giving over the extensors of the forearm region. Okay, so if radial nerve involvement means we will what we will do, we will directly give the treatment over the forearm extensors alone for this student, but we have to note that it also supplies to triceps and also anconeus. Understand? So, இது மட்டுமே நம்ம கான்சென்ட்ரேட் பண்ணக்கூடாது. We also have to concentrate over the triceps muscle also, because triceps muscle also is nerve supplied by the radial nerve only. Yes or no? So, நம்ம இது மட்டுமே கான்சென்ட்ரேட் பண்ணக்கூடாது. We also concentrate to the triceps muscle also. So, எப்படி கான்சென்ட்ரேட் பண்ணுவீங்க? By assessing the muscle power of the triceps. If the triceps muscle power is become decreased or there is no action means we can give stimulation over the triceps muscle also. Okay, is it clear? Any doubt still now? Okay, thank you.